Ted Gideon. So welcome, Ted. Ted's an assistant professor of teaching and the faculty director of the undergraduate program, undergraduate practicum in the program of public health at UC Irvine. And he's going to be talking about a COVID-19 chat line related to the practicum experience. So welcome, Ted, and thank you. I'll turn it over to Ted for his presentation. Thanks, everybody.
Great. Thank you. I assume that it is shared correctly. Always want to make sure because every once in a while.
I can see it.
Okay, good. Okay, so yes, I'm Ted Gideons, and I am from the UCI program Public Health. And I think since I wrote that bio, I am now the director of the undergraduate program in addition to the practicum. So this is the actual, the screen, the first slide that I used last year when we first talked about this, which was in the middle of the high pandemic or whatever you want to call it. And it was about a COVID-19 chat line that we created out of nothing and out of desperation at the beginning of the pandemic. And let's see if I could make everything work. So now we're updating it. So the only main difference on the authors is that we have Megan Padilla, who is added, and I'll explain who she is in a few moments, and we had no conflicts to declare. So some context. We have 1,130 students majoring in public health at UCI. We have by far the largest undergraduate public health program in the country. From what I can tell, the next largest is about 2/3 the size. So it's a lot of students. We also have, like all public health undergrad programs, capstone projects that are, depending on this place, it looks like a practicum or some sort of long paper, and we combine them as the 10-week practicum that integrates a intensive writing class with these 100-hour internships. So not surprising, this was difficult when COVID hit and all of the UC system abruptly went remote, which meant that everyone had to suddenly be online. We also couldn't allow our students to do in-person practicums for all sorts of reasons, though some of them definitely would have if they had the opportunity. But only 15% of our sites were able to go virtual. The sites themselves, most of them kept operating, but they couldn't do internships that were virtual. So we had, needless to say, suddenly 85% of our sites were gone. And that lasted for basically 6 quarters. So what we did was, at the same time, of course, we had rampant misinformation and disinformation. And as you might know, I mean, obviously, it's particularly a problem in all sorts of places, but Orange County has its own special sort of conflicts and problems around misinformation and disinformation. And this is from the COVID-19, a test run at socialism sign is from a protest in Huntington Beach in the OC. So all these things are happening all at once. What were we going to do? And what we did was we created the COVID-19 chat line. And there's a long story about how all these things came to be, and it was pretty crazy. But the basic mission was we wanted to provide up-to-date information for for everyone who could possibly have access to this through a online sort of chat window sort of thing that we are pretty used to now. We do a lot with customer service, but it goes back all the way to those AOL instant messages, which is very similar. Information from public health students and public health professors. We also needed to train students in health communication, education, and promotion, because we desperately needed to do something with our students who no longer had practicums. So this became a major practicum site for our students. And of course, this was all part of a program to help combat misinformation. And we got a lot of questions. We're not just like, where can I find a testing site, but also what actually is going on? What is the guideline? What does that mean? Et cetera. So last time I was here, we talked about all the ways that it came to be, which was this really from like inventing a real nonprofit sort of agency, basically from scratch, which would have been impossible without two amazing PhD students and a number of people that just started volunteering and helping out. So it's been 18 months and 7 quarters. We are in the 8th quarter of it being a practicum site. And we've been doing this for a long time, and it's somewhat institutionalized, but in interesting ways. So we've had 143 practicum students come through and 165 volunteers, some of which were former practicum students that stayed on. We also have just a lot of public health. We have over 1,100 undergrads. We can have some volunteers, but also our MPH and PhD students. We've had hundreds of chats and calls, which we started taking calls at a certain point in the middle of it initially to help do with a study that I'll mention. And also our students were producing lots of materials, infographics, but also translations of lots of materials around, they were basically health communication or, from brochures to basic information into Vietnamese, Korean, Spanish, and Mandarin. Orange County is one of the most diverse counties in the country, and UCI is an unbelievable and wonderfully diverse student body that it wasn't hard for us to find people that could do these translations. We just basically said, who can do it? And we had students already. We also finally managed to get a full-time supervisor and coordinator, and I put the star because she is a star. Megan Padilla, who is now on that list, she has really saved the day, and she's been incredible. She was a former MPH student and a former practicum student, and it's not a great thing that it's hard to find a job during the pandemic, but it allowed us to be like, wait a minute, what are you doing? And there she was. And so we won the practicum outstanding undergraduate practicum site. So this may sound like just want to make something about that award. So technically, I and Mariah Rennerstrom, another person, would be deciding who would get this. So it's like, well, that sounds like double dealing. It looks like an inside candidate. However, there were actual student evaluations. We do this every single quarter, and I'd never seen student evaluations that were so good for any site ever. And a lot of it had to do with Megan, but also had to do with the fact that we were making sure that the actual site was really focused on what they were supposed to learn. So it was pretty great to see that the response from the students, that they were really learning things. And also it wasn't like a big award, it was just a plaque. So it's not like we gave someone money that, anyway, but beyond these actual practicum and talking to people, there was a lot of other things that we started doing because we had the infrastructure. So we ended up consulting with and sort of helping out with other projects. The ACT-OC study, which was a seroprevalence study around COVID, we provided a lot of hotline support for it and helping with logistics and stuff like that, where the phones started coming. We've also been sort of forced UCI Strategic Communications to use us to help them provide the better information through all the various ways they do that. Currently, they utilize public health extensively. And we have helped on that. We've also helped, the city of Santa Ana with outreach around testing and vaccines, and the OC Healthcare Agency, which is the county public health agency in Orange County, which is, if you Google, you can imagine how difficult it has been. This is one of the counties where the director had quit under basically out of fear from a lot of harassment from citizens, but we have been helping them recently promoting vaccine information and education, and we're going to be expanding phone access because with the realization that there are not people that have tons of computer access, that would mean that you would make it more difficult to use a chat line. So we also this September had a major design upgrade, and I'll talk about of course universities can afford these things. There was no money for this. And it looks great. I mean, it's certainly, and if you want to, here's our little, if you want to see it and see all the cool things that are on there, I highly recommend it. Also, you can just Google UCI chatline. And I'll sort of explain why it's particularly cool, because making a real website is hard, and it involves a lot more work than a lot of people sort of think about. And this was sort of one of the key lessons learned. So since 2020, we've learned new lessons. The previous ones were like, oh my God, we have to create this from nothing. Well, now this is a little bit more fine tuning. One is that we had all of these various communication things. We were remote, we're still almost completely remote. I occasionally see Megan in person now that we are back in the offices. But we started on Slack, and then we switched to Slack kept trying to give us make us pay huge amounts of money per student and per user. So we switched to Google Chat, which we hated, though it was functional. And then we went back to Slack, and then conveniently Slack, under its new ownership, has made things very, very cheap for educational institutions. And these are just sort of like the trial and error of being a new and rapidly expanding organization, and which there are probably in a couple of years, we're going to hear a lot of really interesting talks at various conferences about what the nonprofits have done that didn't exist before, but suddenly do. And this was just one of the things that we figured out. We also, a shoestring budget is just saying it nicely. We had no money. We basically had to invent it out of nothing. Dr. Rennerstrom, Mariah, and I used our startup funds to pay for every little subscription that we needed, whether it's for scheduling students or whatever. And we started like finding money from different places. Those are pictures of Tommy Stevenson and Vicky Strother, who like handle the money situation. Eventually we needed, well, you can't just sort of shoestring budget an actual full-time employee like Megan. So I would say the best way that we did it was through a lot of creative arm twisting with the dean, who's very supportive. But in other places, like, how are we going to do it? We need this, we need this, we need this. How are we going to figure it out? And using relationships that were already there, that, for instance, the incredibly talented woman who designed our website just happened to also leaving design to get an MPH at NYU. One of our research managers knew her, and she said, yeah, this will be really cool for my MPH resume. And she just did it for free, and which is great. We also eventually, we had knocked down the practicum requirement hours down to 75 because of the complexity of what was going on with the pandemic. And then we realized, actually, as things got better, we could go back up to 100, which is a more commitment, but it also means that more work, but more a stricter thing. And this has been some of the students were like, oh, I don't want to do it. And then they realized, oh, wait a minute, this is actually a real job. 10 hours a week is different from 7.5 that are sort of haphazard around whatever time you can figure out. We also realized that slowing traffic, like if you don't get a lot of calls or chats, it doesn't necessarily mean that there isn't a need. You can definitely like, oh, it's decreasing. No, it means that it can be just a natural lull or other things are going on. And so I really think of this as, what are the lessons to learn around this as we continue, definitely for the next year? How do we reach the people that aren't on the internet, who aren't using the chat lines? Now, obviously, tons of us use it. People are on their phones, they're doing all these things, but there are a lot of people who aren't or don't think of that way, and particularly older people. This has been one of the big issues around telehealth. So how are we going to reach them? And that is why the phone is coming in, but also other ways that we can sort of encourage interactions that aren't necessarily through a chat window. What is the best way that we can collaborate across agencies? Because we are working with the county public health, we are working with cities, we are working with other organizations. When it's just these people that are sort of inventing it out of nothing, we've learned a lot about like, how do you work them with different groups? How are we going to figure it out? And some of this is, a lot of organizations are like, well, we've been doing this for years, but this was a seat of the pants educational process that was really focused on what are we going to do with our students. And now it's become something where there's a real infrastructure, and what can we use that infrastructure for? And some of it has become like, we can actually use this as a lab for our health communication professors and grad students, which is one of our plans. And to use this for, one of the issues is that COVID is probably like going to be endemic in many ways. And the chat line will need to be endemic as well. It won't necessarily have to be a epidemic emergency prep, but actually something that's there that can deal with things as they come, as opposed to instantaneously. And clearly, despite the fact that we all know that outside of public health, something like, oh, the pandemic's over. It's obviously not over. And the need is really still there. So the community really needs easy access to information. The misinformation is unabated. You just go on Twitter or you just talk to anyone you meet on the street. There's a lot of confusion, and sometimes it's deliberate, but a lot of it's just people, there's so many conflicting guidelines. I live in Los Angeles where everyone wears a mask all the time. And you go, to the Orange County and no one wears masks except on campus at UCI. And then the rules are different everywhere. So people don't know what to do, and there need to be easy places for people to ask those questions. Also, obviously, we're in Delta, but there is Delta Plus. There is going to be another one, and it may be a COVID thing, and it may be a different kind of COVID. We don't know. This is not going to stop. Also, the inequality and the inequity around around health literacy and access is unfortunately not remotely going away, despite what we've all learned over the last year. So also our students need this. Despite the fact that the practicum sites are all back, we still have lots of students that want to do it. And the students, we are graduating hundreds of students into the public health workforce every single year. And they need practicums, but they also need counseling. They need guidance. And they're learning how to do community outreach. They're learning how to do service projects. The actual process is creating social ties with each other and with us, and with the community, which even if it's virtual, it is real and it is there. And this practical experience with emergency, with COVID, is giving these students something that really has not happened with public health students in a long time, which is an actual health emergency. And this is really giving them some great practical experience. It is also thrilling to be able to see these students who are learning things and going out there to, I keep saying to save the world, but to at least save their communities. It definitely helps with those of us who are depressed about the world, the self-efficacy I feel of going in and helping students go out and save the world. It's incredibly inspiring. So I was particularly excited about the previous talk, where I saw, like, look at those undergrads doing such great work, and clearly doing a lot of work and working very hard. So also, all of this work is creating portfolios of writing samples and infographics and support projects that they can use on they're looking for jobs, which is a big deal for all of our practicum students. So I want to thank you for sitting here and listening to this, sticking around to the end, and especially thank you my co-authors, Sarah Goodman, who is tireless and has I think on the call, but she's also moderating. Chantel Nolan, Sarah and Chantel were basically the reason this happened. Megan Padilla, who is our superhero, and Mariah Runnesrum, my predecessor, the director of undergraduate program, who is also amazing. The chatliners, over 308. We keep adding more. More than half have been volunteers. The essential assistants from my practicum coordinator, and then Sharon and our Dean Bernadette, who gave us all the money. Whatever little of it has been amazing. And also all of you, because without all of the work you are all doing, we wouldn't be able to have anything to tell the chatliners what to do, how to figure it out. And it is really, I mean, it's inspiring here to come here and hear all of the things that we are going to be able to do next. So thank you. That is it. Yep.
Thank you, Ted. And nice to end on such a positive, note, and seeing some activity in the chat. So